Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Papillae Sirocco series. This audio podcast is part of a Labostix Communicado. This audio podcast is part of a Squadron Kamikaze. And this audio podcast is part of a Storm Labostix production. A little bit in around the pathogenesis in around hemolytic in around hemolytic uremic syndrome or HUS. So most of the sort of common the sort of main cause or common cause of HUS and intrinsic acute renal failure in pediatrics in the United Kingdom, in France, in around France, in Europe, for example, as well, and in the United States, and United States in industrialized countries. Is where young people can have the symptomologies that are around around diarrhea, around diarrhea, having diarrhea as one of the main symptomologies. There are no specific therapies to treat the the usually the to treat the diarrhea, which which can be in young people, where it's where pediatrics and young people with HUS can present with a sort of a bloody sort of a diarrhea. Mortality is as high, or has been evidenced as high as 8.5, 8.5%, and up to 30% of survivors may develop further glomerular filtration rate impairment or albuminuria. Use of anti-motility drugs or therapies may increase the risk of developing HUS HUS, and it is a rare syndrome, post puberty. Atypical or AHUS can be inherited or acquired, and does not appear to vary by race, by ethnicity, gender, or geographically. Data on the prevalence in around AHUS is or has been limited. The uh, the the these the sort of symptomologies around HUS have been highlighted in one of the a previous audio podcast as part of this series. However, to sort of iterate again, the patients can present with anemia or low hemoglobin, where there's petechiae or sort of purple like a rash sort of present, which is referred to as petechiae, and purpura and fever are also common. There's gastrointestinal bleeding, or there can be gastrointestinal bleeding, and is often found and where there's where symptomology is aligned with where patients have a bloody diarrhea as well. Uh, GI disease, gastrointestinal disease, may be severe with hemorrhagic colitis, toxic megacolon and rectal prolapse, and bowel necrosis. There may be neurological symptomologies, and there can be cardiac involvement, which may lead to CHF and where CHF and arrhythmias. that draws this audio podcast to a close. This audio podcast is part of the Papillae Sirocco series. This audio podcast is part of a Labostix Communicado. This audio podcast is part of a Squadron Kamikaze, and this audio podcast as part of a Storm Labostix production.